common that we hear about people complaining about their doctors, that the doctors aren't spending enough time with them, they aren't giving them the quality care that they want. Except for you, of course, because many of your patients are always saying how much they love you because you give them the time and you really listen to them.
It takes a long time to learn that, Vicki. You know, what we're taught in medical school is oftentimes a lot different than what we find in clinical practice. And this is another one of those examples.
Yeah, I'll say. And now the medical schools are catching on. And in fact, they're saying that it's more important that doctors have communication skills than even their grade points. That's really a big statement for them to make. In fact, they're practicing some of this at some of the major medical schools like Stanford and Palo Alto, California, and UC Berkeley and UCLA and University of Virginia, Virginia Tech.
There are a lot of places that are catching on. 13
places in Canada. So tell us a little bit about what they do with these multi-mini interviews.
Well, what they're trying to do is figure out how they're going to determine whether or not somebody's going to be a good doctor. It's not just what you know. There's nothing worse than going to a doctor who's arrogant and who has to be right and is sure that there's nothing that you can add as a patient to the story and say, this is the way you're going to treat this condition because it's what I think is the right thing to do. And so what they're doing is they're looking for ways to test people for things other than their skills. I remember a long time ago when I went to medical school, or before that, they had this test called the MCAT, which is your aptitude test, to see if you knew enough in terms of facts to be able to be oriented to becoming a doctor. But it wasn't so much oriented to find out what your personality was like. And so what they did in this particular study is they put students in a situation where they had a whole bunch of people interviewing them and asking them questions that would kind of surprise them. It wasn't so much what they knew about medicine as it was their people skills.
And how they could think on their feet, and if they were team players, and, and how well they listened to what the questions were. It was kind of fun the way they set it up because they made them really think fast because it was like they set a timer, and all of a sudden it was go into the room, and then they blasted them with a question, and then they had to just take off. It was an
off-the-wall question, yeah. It's good to see how you can catch your feet, catch your breath and shift your feet around so you can be balanced. You know, it took me a long time to learn that it wasn't what we do to patients, but how we were being with them that made the difference of whether or not these people actually improved or had confidence or hope in the treatment. There's nothing worse than somebody coming in and blurting out a diagnosis and saying, I know what you have and these are the treatments that you're going to take, and if you have a cancer, it's going to be the radiation, chemo, and surgery that you're going to do, rather than sitting down and saying, gee, Mrs. So-and-so or Mr. So-and-so, we have a problem here that we need to work through.
Well, I remember an example of this is one time years ago, I took my dad to the doctor. My mom went along too, and we were in the room waiting for the doctor. You know, after the waiting room, they move you into the examining room, and we were sitting there waiting. The doctor walks into the room, doesn't look at us, doesn't greet us, doesn't shake hands or say hello or anything, walks into the room, turns his back to us because that's where the chart was, and stood there leafing through the chart without even acknowledging us. Well, I happened to know this doctor, and so I said, hey, hi, so-and-so, and he turns around, oh, Vicki, hi. And I said, well, these are my parents, and da-da-da, and I thought, this is what his bedside manner is like?
Yeah, well, see, when I was at Duke Medical School, thought of as a highly regarded school that's people-oriented and into some complementary and alternative approaches to healthcare, what I was told at the time was don't get attached to your patients. Be a doctor. Stay isolated. Don't do things that are social with them. Don't interact personally because you're a scientist. And I was thinking, how could anybody trust me if we didn't have a relationship where they understood me? And how in the world would I know what to do with my patient if I didn't understand the whole person?
Well, think about it, too. It's some of these teaching schools or teaching hospitals, when a patient's in the bed and all these doctors,
the entourage of doctors comes to the bedside.
They come to the bedside, and they many times are talking over the patient rather than to talk to the patient. And it's like it's the patient in room 402 that they're...
It's the gallbladder there. Or it's the heart attack in room 425. All these things that we do in that setting are teaching our students the wrong thing, because our schools, for the most part, are oriented to make sure that we understand, as learning doctors, the mechanics of the illness and what the treatments would be. So it's not uncommon for 10 or 15 people to crowd around the bedside and for the doctors to expose parts of the patient that are sensitive, to start poking and prodding and not paying a whole lot of attention to the patient and saying, see, this is what you find in this disease and what the outcome is in that, and talking as though they aren't even there, so that they get the idea that they're not talking to me, they're talking about me.
Well, this happened to my grandmother. She had a horrible type of cancer in a very embarrassing area. And because it was very unusual, the doctors would just keep coming in and looking at her all the time. And just treating her like she was the cancer, not
Right.
like she was who she was, you
Right.
know, not like she was the person.
So what we're trying to do is change things so that we actually look at the relationship that we have between the healer, if this person's really sophisticated and talented, rather than just somebody who's a mechanic, the healer and the patient.
Because
It's a relationship.
Yeah, and they're
It's-
just trying to get their thing done.
Wait, that's not getting it done. What that's doing is just looking at the mechanical problem. But people are, their illnesses are there, but but people are attached to them. And if you don't pay attention to the person and their feelings, you can't individualize treatment. You can't get the support of the patient. And we talk about non-compliance and problems where patients don't follow the advice of the doctor. Well, a lot of the time they don't understand the treatment. They don't understand what it's doing, except that it's making them feel bad. They know that it's costing them a lot of money. And they need to have these things explained to them in a very personal and sensitive way.
Well, no wonder there's so many lawsuits.
Exactly. That's what leads to
It
them.
makes people angry
Exactly.
because they want to be looked at like, a person and have the doctor caring a lot about them. I know that I've heard different people that have had a diagnosis of cancer that just love their doctors.
Absolutely.
I think oncologists have had to really learn this skill.
Well, they're learning it more so, and there's some really wonderful oncologists, and yet I've seen some that are just like, what it was in medical school back at Duke, 40 years ago, where they're academic, they're just looking at the facts, they don't want to look at the relationships. So they say, well, if you need relationships worked out, go talk to somebody, there's a priest or a pastor or a rabbi, or talk to the psychologist. But that's not my business. My business is to prescribe the treatment for this illness. That is a very narrow approach that unfortunately is way too commonly accepted as the approach for medicine. So now that we know, after all these years, for most of us who've been in practice, that it's the being with, not the doing to. It's the support and the connection that does the healing. The curing of symptoms, yes, it's important too, and everybody deserves nothing less. But we still need to look at the person. We need to look at what they need in terms of support, emotionally, spiritually, and physically. And if we do that, chances are we're going to have patients who are happy and appreciating what they're getting in terms of being with us.